Hi, I'm Dr. Clifford Albert, and today I'm talking about Smartlipo, Laserlipo. We were supposed to be on YouTube as well tonight, but unfortunately it didn't work out. Technical difficulties, like usual with any technology. But what I'm going to talk to you about tonight is something that's very important to a lot of people at this time of the year. You know, everybody's eating more, and everybody's worried about their weight and watching their weight. But what I always tell all my patients is the first thing is forget about looking at the scale. You know, it's a losing battle. As soon as you start looking at the scale, you're focused on a number. So forget about the numbers. What I really want people to focus on when they come to my office is first about eating healthy and eating normally. So it doesn't matter what you eat. It matters how much of what you eat. So what I always tell my patients is put your hands together. That's the size of your stomach. So first thing I tell every patient is what I want you to do is really eat the size of your stomach. So 2 hands for breakfast, 2 hands for lunch, and 4 hands for dinner. So look at shrinking plate sizes. That's the number one thing. So when you want to control weight, the first thing is control the amount of food that you're using. So I have 4 rules that I use. Eat small, eat slow, eat fruits, vegetables, and nuts, and take the stairs. And then we look at what are the other techniques that we can do to melt fat. Now, I have both invasive techniques like Laserlipo or Smartlipo, and I have non-invasive techniques. So I'm going to talk about all those different things that we can do. But a lot of patients come to me for Laserlipo. Now, why is Laserlipo really the probably the best technique out there to get rid of fat? What we're able to do with Laserlipo is through a 1 millimeter incision, through a very, very tiny incision, we can go in and liquefy fat with a laser device. And so the laser device will allow us to melt that fat evenly, so we're able to avoid contour deformities, and that was a major problem with liposuction, which I've been doing for a very long time. So I've been doing, since I was a resident, we started, doing laser lipo with, regular liposuction with large cannulas about the size of your little finger, so about 5 to 10 millimeter cannulas. And in those days, people got a lot of bleeding and often, even had to end up in the intensive care unit following liposuction. Well, things have really progressed a long way over the past 10 years. Now we're using lasers, and what the lasers are able to do is liquefy that fat evenly and through little tiny holes, tighten the skin as well. And that's really the advantage that we didn't have before. With regular liposuction, contour deformities are things that can happen very frequently. And since we've introduced laser lipo over the past 10 years, we really have seen a complete decrease in that. As a matter of fact, over the past 8 years that I've been doing laser lipo, I've had to go back even one time to do any corrections with laser lipo. So it is really a wonderful procedure. It's done through little tiny holes, and so we can liquefy fat and tighten skin at the same time, which is something we couldn't get before. Typically, when people do liposuction, they get a lot of hanging skin, and you don't get that skin contraction that you get as well as with laser lipo. There's really 4 parts to the procedure. The first part is that we will freeze the skin using local anesthetic. So we're going to go all the way around. This takes usually about 10-15 minutes. We're going to freeze the area we're interested in treating with local anesthetic, a dilute solution. And once that's done, the patient really feels nothing. So that's kind of like going to the dentist. So you do have to freeze the area that we want to deal with. And then we're going to liquefy fat using the lasers. The laser will then be introduced into the skin. It's going to liquefy fat in that area between the skin surface and the muscle. And then what happens is this contracts. So we actually have very good studies that show even in areas that were treated where there were tattoos, that the tattoos shrink by about 40%. So typically when I'm doing laser lipo, I'm going to melt that fat by at least 50%, and we're going to tighten the skin within a range of about 30 to 40% or more. So it's really we're really able to do something we couldn't do before with regular liposuction. The third part of the procedure is that we actually suction out the fat that we've liquefied. So a lot of that fat will become like an oil anyway and kind of leak out on its own. And once it leaks out, you're going to be losing a little bit of blood. You're going to be losing a little bit of the fluid that we've inserted to freeze up the skin. But after that, there's kind of like a pinkish sort of fluid that comes out over the next 48 hours. So the first part of the procedure is freeze the skin. Second part of the procedure is laser lipo. And the third part of the procedure is then suction out any of that liquefied fat that doesn't leak out on its own. But what I can tell you is most patients leak out here and they don't get a lot of leakage at home, which is completely different than what we used to see with liposuction, where the person would go home and leak a lot. The fourth part of the procedure is I use a cannula called the Blugerman cannula, which was invented by a friend of mine in Argentina. Dr. Blugerman essentially invented a little device that's a blunt-ended cannula that we kind of use like think of it like a cheese grater. So it kind of grates down the tissues to make sure that we don't get any irregularities. So the best way to get the best results in terms of laser lipo are to combine the laser with typical technology we use in liposuction to suck out that fat, and then we have the key part is really at the end, evening out any contour deformities that may exist. I've never seen infection, never had to hospitalize anybody, never had any deaths. So this is a really safe technique. It's become super safe, super easy. My patients get back to work usually the next day or within 2 days of the procedure. And I usually see them back about 2 to 4 weeks later just to make sure that all the wounds are healing well. But we don't even have to stitch up the wounds anymore because the wounds are so tiny. So we're working through little tiny holes, and we're going to liquefy that fat and tighten up the skin. You do have to combine this no matter what with proper diet and proper exercise. So really walk, and take the stairs whenever you can. So these are all things that help in terms of maintaining what I've taken out. This is really what I call body sculpting, and we have gotten to a period of time now where body sculpting has just gotten pretty much as good as it can get. We can really stand up the patient, turn them around, get all the different areas that we want to do under local anesthesia. And the key to keeping it under local anesthesia is very important. First of all, it's safer, it's faster recovery. My patients basically get up and walk out of here. Less pain. And also a better result because when you're under local anesthesia, you can turn the patient in all directions. And by doing that, we ensure that we get the most fat removal and the most skin tightening. Imagine if you're under general anesthesia with a tube in your mouth to breathe and you're knocked out, we have to turn you in every direction to be able to get the most fat. So laser lipo allows us to have a safer procedure, a more complete procedure, and a faster healing procedure than what traditionally has been done. And I've been doing this for about almost 10 years now. Wonderful results. It really works well. I think patients have to understand that they still have to do work on their own, and that's the key. Patients have to modify their way of eating, and it's not really a diet plan. It's just modifying the way you eat. And I tell people, forget about what you eat. Concentrate more on the amount of how much of it you're eating. And so shrink the plate sizes. That's really key. If you have any other questions, you can check us out at lasermontreal.com. I do this pretty much, I've been doing it once a week. There's a lot of great questions coming in. What does it cost to do this? Well, the typical area, the area size of your palm is about $1,000. So if somebody's doing the abdomen, you're looking at an area like $2,000. If you're doing the abdomen and flanks, $4,000. If you're going all the way around, you're looking at about $5,500. But that's really treating the entire spare tire. Typically takes about 3 to 4 hours to do the procedure. Local anesthesia. Nobody goes to sleep for this anymore. And most of my patients just get up and walk, they take the bus or they'll take a metro home or a cab home. There will be leakage for about 24 to 48 hours following the procedure. There's no stitches to take out. And I see the patients back at 2 to 4 weeks following the procedure, just to make sure everything's good. The best results will really start to appear over the first month, up to 3 to 6 months later, and even up to 12 months later. So there's a skin contraction that occurs that takes time. So in terms of the best results, usually you expect that at a year because that's when really the wounds are almost invisible. But you're going to start to see it over the first couple of months, definitely. In terms of other things, you can see my videos on YouTube. So I've got videos on YouTube and on lasermontreal.com. You can call us up at the office 514-482-3456. As I said, never seen any infections, never had to hospitalize anybody. This technique works well. It's a wonderful technique that I think in terms of actual energies that we use, I don't think we can get much better in terms of the energies and the type of lasers we're using. They're pretty fast and they allow us to do the job that we want safely, and that's the key. Really, it's a safe procedure. If you have any questions, feel free to come by and see me at the office. And price-wise, you know, it's become pretty much the same price as standard liposuction. Standard liposuction usually is between $3,000 and $5,000. So now, by using a laser, it's actually enabled us to deliver a better procedure to our patients and faster healing time. If you have any other questions, feel free to contact me. It's been great. I'll check you guys. I'll be checking up with you guys next week. Probably we'll be talking about just removing skin lesions. Talk to you soon. Bye bye.